thank you for your support for single payer as the destination for health insurance in the United States. I'm a doctor and I've worked in the health insurance industry for a number of years. And I think we all recognize that the health insurance industry, the private industry, makes money by dumping sick people. My concern is that with a public option that's competing with private health insurance, the private health insurers will dump sick patients onto the public option. It will become more expensive, and we're going to hear from the healthcare lobby and the Republicans that the public option has failed, and that once again, government is the problem, not the solution. Whereas in this case, it is the solution because the public option will insure those people that can't get insurance elsewhere. So my question is, rather than having competing public option competing with private health insurers, I understand your need for an incremental approach to this. Why not just take the Medicare eligibility age and lower it incrementally over several years?
Not only have I supported that, but we came within one vote of getting that into the Obamacare bill, the Affordable Care Act. We were one vote short. Sadly, it was a Democrat from Connecticut, and if you know what the insurance industry means to Connecticut, you might have an understanding of why that vote didn't come our way. But we were very close to pushing Medicare down to 55. And once you push down to 55, it's an easy step to push it on down to 50. There are a whole bunch of different ways to move in the direction of what is, I think, efficient and fair care. One is to let states choose to go to single payer and find a way to support them when they do that. Another way is when there is not a competitive market to insert a public option against that. Another way is to have a public option available everywhere, and another is to drop the Medicare age down, and all those avenues are open. And by the way, I'm actually hoping that we might have some good work done on healthcare in the Senate. I'm on the HELP committee, which is the committee that would probably write the bill. Finance committee has a role too. The chairman, the Republican chairman of that committee, has said, he said publicly, I'm not into repeal, I'm not into replace, I'm into repairing the healthcare system for people. That's what the Republican chairman is saying. So that's a pretty good place to be. And if we can get good, strong bipartisan support going, we did a new education bill that the mayor and others have seen really change things for the better in education. And it was unanimous in this committee, led by the Republican just a year ago. So this is a good committee. This is like a little treasure of a committee where we can do big bipartisan things. And if we can get the healthcare conversation there, then I think a lot of these options become actually realistic.